Well, good morning, Dr. Broom, Mrs. Bush. What an honor to be introduced by you, Mrs. Bush. Thank you so much. And I want to salute both Texan by Nature and Houston Methodist for launching this phenomenal dialogue across the two disciplines. But I have to tell you that for a non-Texan, it's a little confusing to juxtapose those two names, Texan by Nature and Houston Methodist. So when my wife asked me, "Where are you going?" I said, "I'm going to Houston, Texas to be Methodist by nature." And Dr. Broom, here is my requisite disclosure, no conflicts of interest. Let's begin with a little poll. During the last year, please raise your hand if you've taken a weekend or a vacation at a beautiful natural place and felt revived and refreshed. Just about every hand in the house. Thank you. At your home, do you value nature contact, a garden, nearby trees, a nearby park, a lake view? Raise your hand if the answer is yes. Thank you. So nearly every hand in both cases. Now, let me clarify, that is not a rigorous epidemiologic study. But what it does do is corroborate the notion that many of us have, that there is something attractive, appealing, perhaps restorative about nature contact for adults, certainly for children. This is a notion that has animated the healthcare world for centuries. It's why healing gardens were a part of ancient hospitals and can still be found in many of our best hospitals today. Well, could this all be true? Is there a scientific basis for this notion? There is a theory to support it. It's rooted in evolutionary theory, and for those who have not visited evolutionary theory for a long time, I'll give you a notion of how it's unfolding. Or in more relevant healthcare terms, this is the health professional's guide to evolutionary theory. And this is one of the reasons why we need to be thinking about nature contact. Now, the great Harvard biologist E.O. Wilson has put forward what he calls the biophilia hypothesis, the idea that we evolved in natural settings like the African savanna that you see pictured here, and that somehow we are hardwired to have an affiliation with the natural world such that it could actually enhance our health and well-being. Well, that's a theory. What we'd really like to do is see the evidence to support that theory if there is evidence. I'm going to take you through a series of outcomes, of health outcomes, for which evidence demonstrates health benefit. I'm going to take you 5 slides. This is a pedagogical method that we use at the University of Washington called ODTAA. It's one damn thing after another. 18 separate health outcomes. We have evidence more or less strong that nature contact reduces stress as measured by outcomes such as salivary cortisol levels, skin galvanic resistance, and self-reported stress, that people in greener environments have better sleep than people in less green environments, that depression and anxiety are both reduced by green space exposure, stronger evidence for depression than for anxiety, that people in greener environments report being happier. We have evidence of reduced aggression relative to living in green space. This is fascinating. Not only is there less crime in greener neighborhoods, but we have some evidence that along roadways that have tree canopy, drivers are less likely to become angry and aggressive than along similar roadways without nearby nature. And there are prisons around the country now that are finding that showing nature videotapes actually helps reduce the level of aggression within the prison population. Reduced ADD symptoms among children with that disorder, more pro-social behavior, and better social networks among people who have nature contact. Getting to more objective and short-term measurements, lower blood pressure, lower rates of hypertension among people in greener environments, smoother post-surgical recovery, better birth outcomes, in particular, lower rates of low birth weight in greener neighborhoods than in less green neighborhoods, and improved pain control, both during the acute moments of medical procedures and chronically. Lower rates of obesity among children and adults in greener neighborhoods, lower rates of diabetes, better eyesight among children who play outside more compared to children who play outside less. There's a plus minus by the asthma allergy outcome because this is the one health outcome we know for which there is probably more evidence showing harm than showing good. That is, a number of studies show that children who are outside suffer worse asthma symptoms than children who spend less time outside, probably related to the particular species of trees and the kinds of pollen and other allergens that they elaborate. And finally, improved health in cancer patients. very relevant for those at MD Anderson, better general health in general populations, and longer life expectancy among elders. So a phenomenal range of health benefits that have been associated with green space. Now, if you try to read all the evidence to support this, you'll kind of go crazy. It's a very large body of evidence, and the good thing is it's growing fast. We know more and more. So rather than try to take you through the evidentiary base for all of these benefits, what I'd like to do is show you a little sampling, I'll call it evidence tapas, of the kind of research on which we rely to draw conclusions that nature contact is good for health. First, let's look at natural experiments. And I'm going to, even though in the biomedical world we really like randomized clinical trials, true experiments, but I'm going to begin with natural experiments because they're more readily available. It's a little hard to randomize people to a green neighborhood and a non-green neighborhood and follow them over time. Most of our fellow citizens like to live where they want to live. But creative, inventive researchers can find natural experiments and use those almost as if they were true experiments. This is one of the landmark studies published in 1984. The investigator, Roger Ulrich, who for years was at Texas A&M University, recognized that at this particular hospital, in the post-surgical wing, half of the rooms indicated by the green arrow looked out at trees, and the other half of the rooms looked out at a brick wall. It was completely a random assignment which kind of a room you went to after you had your gallbladder out, the cholecystectomy. He looked at the records of all cholecystectomies over a 10-year period, confined this to the summer months when the trees were in leaf, and looked at the outcomes of the patients in the two kinds of rooms. If you were in a room with a tree view, you had a shorter hospitalization by almost a full day. Notice, by the way, that this was the era when you stayed in the hospital for a week after a cholecystectomy, not the drive-through method we favor today. Lower use of pain medications and fewer negative nursing notes. There was no other detectable difference between the two patient populations, so something about simply viewing nature out the window had a substantial impact on post-surgical recovery. A second natural experiment took place at this housing project. This is Robert Taylor Homes, a grim 3-mile stretch of 28 architecturally identical buildings in Chicago, bounded on one side by a highway, on the other side by railroad tracks. Where in Robert Taylor Homes you lived was simply a matter of what unit was available when your name came up to the top of the Chicago Housing Authority list. Some of the buildings had green space around them, as indicated here, and some of the buildings were barren outside. So this was a perfect experiment. Was there a difference between the people living in the tree view buildings and the barren buildings? The investigators at University of Illinois compared people in the two kinds of buildings. They confined their attention to people living on the first floors so that there was a tree view out the windows. They looked at the summertime only, and they were asking delicate questions, so they used community interviewers. What they found was that living in a building with nearby trees was associated with substantially higher rates of knowing and greeting your neighbors, acknowledging and helping your neighbors. The social networks were far stronger. Less aggression, less violent behavior, both as perpetrator and as victim, and better self-discipline, better academic performance, interestingly among girls but not among boys. So this is the first of a number of not completely consistent findings that we'll see in the literature. And the final natural experiment is an experiment currently taking place in Philadelphia. Philadelphia has over 50,000 vacant lots, many of them fairly squalid. The city undertook an effort to green those lots up. Now, not every lot could be done right away. And so you could compare the ones that were completed with the ones that were high on the list but not yet completed, otherwise identical, but different in whether they had been greened or not. In the neighborhoods where lots had been greened, compared to the neighborhoods where the lots had not yet been greened, the investigators found fewer gun assaults, less vandalism, lower levels of stress among the residents, and higher levels of physical activity among the residents. So something about greening those patches of urban land made a big beneficial difference. Let's go to some true experiments. There aren't many of those to report to you, but I'll show you a couple of examples. The first is an example of pain control during bronchoscopy. For the non-medical members of the audience, bronchoscopy is a procedure in which a fiber optic tube is inserted down the airways into the lungs so that the physician can have a look and take samples of tissue from within the lungs. This is what we physicians euphemistically call uncomfortable. And typically, a sedative is used, and nothing but a sedative. But in this particular experiment at Johns Hopkins, the investigators supplemented the sedative with the use of nature scenery and a nature soundtrack. It was this picture and the soundtrack of the flowing brook moving through the meadow, as you see there. They randomized patients who were having this procedure into two groups, one of which had the nature exposure and the other of which had only the conventional sedation. The result was that pain control was substantially better in the group that had the nature contact compared to the group with conventional anesthesia. An inexpensive, safe, and highly effective intervention for pain control. Here's another experiment on a very small scale, but Mrs. Bush, as a former teacher, this one will resonate. This is a junior high school class in Taiwan. The two classrooms are pictured there. Sorry for the poor quality of the photograph, but what you can barely make out is that the experimental condition in the upper picture had a series of plants across the front of the room, and the control condition in the lower picture had a conventional classroom. And the investigators compared the outcomes in the two classrooms. There was no difference in terms of anxiety, stress, and overall well-being among the students. The students in the class with plants preferred their classroom. They liked their classroom better than the students in the conventional classroom, found it more comfortable and friendly, although that effect didn't last for the full 6 months. But importantly, academic performance improved slightly with the plants, and the class with plants had significantly lower sick leave and discipline problems. So inconsistent, but very intriguing results. Let's move to the third and the most common kind of evidence we have, which is observational studies, where investigators take a look at free living populations and observe the impacts of living in green compared to less green neighborhoods or some other kind of nature exposure. The first example I'll show you is this. This was from Marion County, Indiana, where Indianapolis is located. The investigators used what's now a quite common method of using satellite photos to assess the intensity and level of tree canopy neighborhood by neighborhood, and found when they looked at the entire city of Indianapolis that the children in greener neighborhoods had substantially slower rates of weight gain and lower rates of obesity over a 2-year period of observation, not fully accounted for by differences in physical activity levels. Something about the green space seemed to have a positive effect on rates of weight gain. Those who are health professionals in the audience will be familiar with the Nurses' Health Study. This is an enormous study that's been going on at Harvard for several decades, following more than 100,000 nurses prospectively and carefully observing their health outcomes. In a recently published analysis, the investigators took a look at the level of greenness in the residential neighborhoods where each nurse lived, and found that the nurses in the greenest neighborhoods, compared to those in the least green neighborhoods, had a 12% lower all-cause mortality rate, with the strongest impacts on specific causes of death, respiratory, cancer, and kidney, and with no association found for some other causes of death. Something about living in green neighborhoods had a positive effect on the life prospects and health of those nurses. A recently studied fascinating result from Ontario looked at tree canopy across the city of Ontario and looked at a number of health endpoints, asking the question, do those health endpoints vary according to the greenness of the neighborhood? What they found was that the people in the greenest neighborhoods had better general health perception, and they calculated that each 10 additional trees per block had the same impact on general health perception as a $10,000 increase in income or being 7 years younger. They found fewer cardiometabolic conditions, heart disease, diabetes, and so on, and calculated that each additional 11 trees per block were comparable to a $20,000 increase in annual income, and interestingly found no particular benefits for mental health, a little different than some of the other results that we have. And this study, recently published from London, found that the more trees per block, the lower the rates of antidepressant use. This is a fascinating opportunity for study because, of course, in London there is a National Health Service, and it's relatively easy to track prescription use in the population there, so we can actually look at prescription use as an outcome. The last one I want to show you is complicated, so I'm going to introduce this bit by bit. This was a study done in the UK which looked at two major factors. One was social class, and one is the greenness of neighborhoods. So in the wealthiest subset of the population, indicated by these blue bars, as you move from the left to the right side of the graph, as the neighborhood gets greener and greener, you can see that the mortality rate, indicated by the height of the blue bar, decreases. It's not a very steep decline, but among these relatively wealthy people, mortality becomes lower as the neighborhood becomes greener. In a poorer subset of the population, indicated by the red bars, you see the same phenomenon. Mortality is higher, and we know that people who are less well off have higher rates of mortality, but you also see that the decline in moving from less green to more green neighborhoods is steeper than it was for the wealthiest. And in the poorest subset of the population, once again, mortality is even higher, no surprise there, because we know that poverty is very bad for health. But the decline in mortality, moving from less green to more green neighborhoods, is the steepest. Or put differently, the disparities in health outcomes between the wealthy and the poor decline with contact with nature, almost as if contact with nature has the ability somehow to reduce the toxic impacts that poverty have on health, what these investigators called equigenic effects of nature contact. We know that one of the most corrosive influences on health in any society is poverty. Until and unless we can reduce the level of poverty, it may turn out that nature contact is an effective way to mitigate the impacts of poverty. So, to summarize all of the evidence that I've shown you and alluded to, a wide range of methods is used in studying the health impacts of nature. The exposures are measured in very different ways, the outcomes are measured in very different ways, but as you look across the entire body of evidence that we have, overwhelmingly, the outcome seems to be that nature contact is good for health in a great many ways. And we often don't understand exactly how that works, but we can see observationally that it seems to be true. What do we still need to know? There's a lot we don't know. Well, I would submit to you that these 6 areas may form the backbone of a research agenda moving forward, and if Texan by Nature and Houston Methodist proceed in working together to clarify some of the outstanding questions, a framework something like this may be useful. Let me take you through each of these one by one. Mechanistic biomedical studies. We don't really know how it is that nature is good for health. What are the mechanisms? People have posited a number of mechanisms, perhaps improved air quality, because we know that tree canopy helps to reduce air pollutant levels. Perhaps it's that being in green areas promotes physical activity. Perhaps it's that social connectedness, which we know is good for health. Perhaps it's reduced stress. A recent paper by Ming Kuo, a wonderful researcher in this field, suggests that it's strengthening immune function, and she makes a good case for that. It's not one or the other. It may be multiple impacts, but we need to understand the mechanisms of benefit so that we can best deploy this intervention to protect people's health. Secondly, exposure science. What is a dose of nature? Do you need to have access to trees, or would bushes do the job? I mean the small shrubs. If access to trees is necessary to improve health, do they have to be in leaf, or is tree exposure during the winter okay? Do you need to be out among the trees, or is viewing the trees through a window sufficient? How much time do you need to be exposed? What is the sensory pathway? Is it visual contact? Is it auditory? Is it olfactory? Is it tactile? So there's a lot we need to know about what is a dose of nature. I'm showing this picture of an instrument because new instrumentation helps greatly at quantifying doses of nature, and this really represents a frontier of research in this field. Plain old descriptive epidemiology. What are the health benefits of nature contact? I've reviewed a few of these kinds of results with you, but there's a lot we still don't know. What is the dose response? How much additional benefit do we get with greater doses? Who benefits? What subpopulations will benefit the most from nature contact? What about returning veterans with PTSD? What about patients suffering from symptom-defined, poorly understood syndromes such as fibromyalgia? What about patients recovering from myocardial infarction? We have evidence for each of these and many other subpopulations of benefit, but if nature contact is at all like medications, not everybody will benefit the same. Some people stand to benefit more, and we need to know who that is. Are there particular developmental windows among children, as there are for so many other parts of child development, when it's especially important to be sure that children have nature contact? What about nature contact among migrants? If you grew up in the Texas Panhandle, and I grew up in the Cascade Mountains of Washington State, and I moved to where you are, Is that nature as good for me as my home place nature? Can we adjust to different kinds of natural environments and benefit from them as much as we can our native habitat? In a mobile society, that's an important question. Which health outcomes should we be measuring? Clearly, many conventional medical outcomes are important to measure. What about psychological health? What about job performance? What about levels of stress? What about plain old human happiness, which is an important and measurable outcome? And for how long do the benefits last? So a whole series of questions that would comprise the epidemiologic research agenda on nature and health. Now, I mentioned before that at least one study, but it turns out there are several dozen, seemed to suggest that poor and disadvantaged populations may disproportionately benefit from nature contact compared to well-off populations. We need to understand that better and understand the best ways, to the extent that it's true, to bring nature contact to those disadvantaged populations. There's a whole economic and policy agenda that we need to undertake. What will it cost to provide nature contact to people? What are the benefits? And is the cost worth it? And how do the cost-benefit ratios that derive from nature contact compare to those from other interventions so that we can decide how most wisely to spend our funds? And finally, what we call implementation science. This is the science of what works. Those who are physicians or nurses in the audience are familiar with drug trials, where we actually think we understand the pharmacology. We've tested the drug initially to be sure that it's safe, and then we put it into practice by giving it to patients to see whether it works. Very, very analogous situation here. If we think that nature contact is good for health, then what are the ways of delivering nature contact that are most effective and cost effective? Can we prove that they work? This is also often the same as program evaluation, where when we offer a trail, or we offer a healing garden in a hospital, or we offer nature contact programs for children, we measure the impact to see that it's working. Now, I want to make two comments about how we take the results of that scientific research and apply it to policy, because in many ways this is very analogous to conventional biomedical research when we do studies of surgical interventions or of medications, but in at least two ways it may be different, and this is an intriguing, at least for me, issue to think about. The first is, what if we're wrong? Now, when you test a hypothesis, let's say A leads to B, medication leads to improvement, there are two ways in which you can be wrong. The first is if the medication doesn't work, but you make a mistake and concludes that it does work. It's called a type 1 error. And the other is if the medication does work, but you mistakenly conclude that it doesn't work, a type 2 error. We're pretty strict in biomedical research about avoiding the type 1 errors. We don't want to conclude that a medication is effective when it isn't, because there's a downside to making that mistake. Medications have side effects, they are expensive, and we are forfeiting the ability to treat a patient with something effective. We're so strict about that that we have the p is less than 0.05 rule, meaning that we demand of ourselves a 95% probability that we're right before we conclude that we're right. But we may want to be more forgiving in the case of nature contact because the downside risk of being wrong is pretty low. After all, what if we were to conclude that being outside, enjoying nature, playing in the park is good for people, but it's not quite as good as we thought it was? That's okay. Still lots of other benefits. And the second scientific issue is exactly that. When we test a medication, our only question is, does the medication work and is it safe? Safety and efficacy. And that's what we tend to tally. But when it comes to nature contact, we need to extend beyond the biomedical realm because there is a whole series of additional benefits, from spiritual benefits to environmental benefits, that we have to add to the biomedical benefits to fully reckon the benefits of nature. So it's a little bit different process of moving from science to policy than in conventional biomedical research. So coming down the home stretch now, are we ready to write prescriptions for nature? Well, I'll let you be the judge of that based on the available evidence, but I will tell you that there is a widespread momentum in that direction. This book, Last Child in the Woods by Rich Louv, popularized more than 10 years ago the notion that children don't have enough contact with nature. He has subsequently made the same case with regard to adults. That has stimulated a number of groups around the country. The Children in Nature Network is pictured there in the upper left. Texas happens to have one of the best chapters of the Children in Nature Network in the country, and some of its leaders are in the room now, but other environmental groups as well working to reconnect kids with nature. We have legislation at the state and federal level that's semi-tongue-in-cheek referred to as the No Child Left Inside legislation. The National Park Service, whose 100th birthday we all just celebrated, has embraced health as a theme for its work in getting people into parks. Workplaces more and more are providing nature contact to the workforces they employ because they understand that people are happier and more productive. There's the Apple campus on the left, and that globular thing that you see is the new iconic structure in my hometown of Seattle. That's Amazon's headquarters. Inside, it's a little forest where the employees can go enjoy nature during the day. Nature contact as a recreational asset. This is a recent newspaper story about hotels that are offering nature contact in their facilities because the guests like that. And finally, the question of prescribing nature. Well, there are park prescription programs around the country. As I said, you'll need to be the judge of whether we have enough evidence to move in that direction, but I think we can all agree that as the evidence base gets stronger and stronger, we in the healthcare world will want to embrace wholeheartedly the concept of improving our patients' health and well-being with nature contact. So in conclusion, I've tried to make the case to you that nature contact offers a number of potential health benefits and well-being benefits, that the available evidence is quite strong and suggestive, if not yet complete. We still need to do more research, and I hope that that research initiative emerges strongly from today's meeting. We need to be thoughtful about such issues as our thresholds for proof and the reckoning of co-benefits that flow from nature contact. And implementation is moving ahead, and we are all riding a wave by being in the room today and considering this topic carefully. Thank you very much for your attention and for the good work that you all do.